Hi guys, and welcome to yet another episode of my medical insights. And this tutorial is about community handling. This is the BioNTech vaccine. I'm gonna vaccinate 21 patients today, and I'll show you today how to prepare the vaccination. We are part of the vaccination campaign. I'm glad that I got 3 vials today. Usually you can order all the stuff you need to prepare the vaccines alongside, but in this case I have already spare material at my practice, so I'll just show you how it is delivered. This one is the packaging. You get the naming stickers along to dispatch them into the international vaccination card, and of course the bills, and then we have some cooling packs, and I've got 3 vials today that we are gonna prepare for our patients today. Let's first of all check whether the dispersion delivered is white or off-white, and if it is, we shouldn't use it, but in this case it is really a clear emulsion. After dilution, each multiple dose vial contains 6 doses. Some of the patients or some of our colleagues have told us that also 7 doses can be extracted out of 1 vial, so that's what I'm going to try today. Maybe we are lucky enough to get another one of 0.3 milliliters. We should strictly adhere to aseptic techniques when preparing our vaccination. Make sure the vials are at room temperature and not cold when touched and taken out. Then what we're going to do is we'll just gently shake the vial 10 times. And this is just to mix the dispersion. We must not shake the bottle, and it is strictly forbidden to transport this vial to farther distances in order to ensure that the proteins inside are not damaged. Okay, what we're gonna do now is we'll just allow the thawed vial to come to room temperature and be inverted 10 times prior to dilution, and we won't shake it. Here is all the material needed. We have a disinfectant spray. This is natrium chloride, 0.9%. And then we have 1 milliliter syringes, 1 2 milliliter syringe, a needle that is 21 gauge. This one is needed to open this bottle under very sterile and aseptic circumstances, and these needles are needed to administer the vaccination afterwards. So this is the sodium chloride, 9 milligrams per milliliter, so 0.9% solution for injections. I'll just open it, put the spike inside, Then I'll take this 2 milliliter syringe and take out 1.8 milliliters of sodium chloride. Just let it there. Then using a swab, we are going to disinfect the stopper of the diluent. This is my vial again. That's how it is shown. September 21 is the expiry date. I'll just open it. Gently put some disinfectant on. And then just make sure that it has given some time, half a minute perhaps, to dry. Okay, we are using this 21 gauge or narrower needle for a syringe that had been delivered usually along the package in order to extract the 1.8 milliliters of diluent. So take this out, put the syringe on, and what we can do is just going to insert the sodium chloride gently into the vaccination. You may feel some pressure in the vial when you add the diluent, so make sure the vial pressure is equalized by withdrawing another 1.8 milliliters of air into the vial before taking the syringe out. Okay, this is done, and now I'll just pull back wait until I'm again at the point of 1.8. Okay, there we go. This is it. And what usually is done is that you leave the needle inside in order to extract the vaccination out of it. So that's what we are going to do. I'll just gently shake it and then make sure it's 0.3 milliliters we extract and pull out. And the extra air should be okay. This is the first one. There we go. This is the prepared vaccination that we have for our patients now, and that's all. We can start with the vaccination. The diluted vaccine can be stored between 2 and 8 degrees Celsius. Within 31 days, it is said it should be used, and after dilution, it is recommended that you should administer the vaccination into within 6 hours. Far better and perfect would be a range of 1 or 2 hours after the vaccination has been prepared. So, and the endos must contain 0.3 milliliters of vaccine, of course. So I hope you like this video. So this is Dr. Shazi-König signing off from Schriesheim, and see you next time. Bye bye.